The Tanzanian government says it's working to address a massive deficit of health professionals in the country. According to the country's Ministry of Health, the current workforce of over 100,000 professionals is only half of what the country's 60 million people need. Isaac Lukanda of the SABC has more.
The Tanzanian government says it is in the process of recruiting more than 10,000 new medical professionals to fill a large gap in the country's medical field. Ministry of Health officials say because of a lack of medical personnel, only 43% of Tanzanians get diagnosed when ill, and only 53% of those go on to get treatment. According to the World Health Organization, the doctor-patient ratio in Tanzania is 1 doctor to 20,000 patients, while its recommended ratio is 1 doctor for every 300 patients. With just 5.5% of the national budget going to the health sector, the Ministry of Health says increasing the number of health professionals in the country is a huge challenge. To get around that, the government is hoping that a volunteer program for health workers it launched last year will help curb the shortage of skilled health personnel at health facilities, with studies showing that more than 50% of all medical students in the country have a tendency to leave the medical profession. The government says it is also working on improving incentives to retain more of them. It hopes that by doing so, it will get a step closer to improving healthcare services in the country. Isaac Lukando, SABC, Dar es Salaam.